This is a patient who had a DVT study done for left lower extremity swelling, and I just wanted to point here we have the common femoral vein on the right, and when we look at the waveform here, we can see this pulsatility to the venous flow, which is normal. Now if we look at the other side on the left, we can see that the waveform looks different. You have a much more flattened waveform here, represented by the left common femoral vein. And so when you see this flattened waveform here, it makes you think of something that's maybe more proximally occlusive. And there's a differential diagnosis for this. This particular part right here is not actually normal pulsatility. This is when they squeeze the calf to see if there's patency between the calf and the common femoral vein. So that's why we get this little blip right here on the spectral waveform. But overall, the spectral waveform is much flatter compared with the other side. This patient ended up getting a venogram that was performed to look for something more proximally occlusive. And if we look at the right here, we can see the normal right common femoral vein coming back here into our iliac vein here. On the left, we can see something much more diminutive here, that this is your artery right here. Let me zoom into it. This is your vein right here, and you can see how much smaller the vein is when it comes to the iliac vein. This is the iliac vein on the left, and here it is on the right. It's much smaller. And there are all these collateral vessels that have been created between the left and the right femoral systems to account for this lack of flow within the left iliac vein. And so this is actually a cause of flattened waveforms, since the left doesn't communicate easily with the heart and the lungs. You're not going to get that same kind of normal pulsatility of the femoral vein on the left when compared with the right. And the differential for this could include chronic changes. This is chronic venous changes. There is probably some kind of thrombosis in the past that led to this occlusion. There's no acute DVT right here. That would also be in the differential diagnosis for this. And then other things that could create this would be some kind of mass effect from maybe a hematoma or a mass on the left iliac system.